PCR of skin lesions. A 22-year-old woman presents with painful genital ulcers and dysuria. Physical exam reveals multiple vesicular lesions on the vulva. She is sexually active with multiple partners and uses condoms inconsistently. What is the most appropriate next step in confirming the diagnosis? A. Viral culture of the lesion. B. Serologic IgM testing for HSV. C. Zinc smear. D. PCR testing of the lesion. Correct answer: PCR testing of the lesion. Explanation: PCR of the skin or mucosal lesion is the gold standard for diagnosing active HSV infection due to its high sensitivity and specificity. Viral culture is less sensitive, especially in late-stage lesions. Serologic tests do not confirm acute lesions. Zinc smear is outdated and nonspecific. Question 2. CSF PCR for herpes encephalitis. A 48-year-old man presents with altered mental status, fever, and new-onset seizures. CT scan is unremarkable. Lumbar puncture shows lymphocytic pleocytosis, elevated protein, and normal glucose. MRI shows hyperintensity in the temporal lobe. Which test would most accurately confirm the suspected diagnosis? A. Blood culture. B. CSF gram stain. C. CSF PCR. D. EEG. Correct answer: C. Herpes simplex virus encephalitis, most commonly due to HSV1, affects the temporal lobes. The diagnostic test of choice is CSF PCR, which is highly sensitive and specific for HSV DNA. EEG and MRI support the diagnosis but are not definitive. CSF gram stain and blood cultures are typically negative. Question 3. Zinc test. A 6-year-old boy presents with a vesicular rash on the chest and back after several days of fever and malaise. A smear from one of the vesicles shows multinucleated giant cells on Giemsa stain. Which of the following viruses is most likely responsible? A. Cytomegalovirus. B. Epstein-Barr virus. C. Herpes simplex virus. D. Human papillomavirus. E. Parvovirus B19. Correcting herpes. Explanation: the Zinc smear, while outdated, detects multinucleated giant cells seen in HSV1, HSV2, and VZV. It does not differentiate between them. CMV, EBV, HPV, and parvovirus B19 do not show this finding. Question 4. Cowdrey A inclusions. A biopsy of a vesicular skin lesion from a patient with recurrent oral ulcers reveals intranuclear eosinophilic inclusions. What is the name of these inclusions, and which virus family is responsible? A. Negri bodies, rhabdovirus. B. Councilman bodies, flavivirus. C. Cowdrey A inclusions, herpes virus. D. Guarnieri bodies, pox virus. E. Lewy bodies, alpha-synucleinopathies. Correct answer: C. Cowdrey A inclusions, herpes virus. Cowdrey A inclusions are eosinophilic nuclear inclusions seen in HSV1, HSV2, and VZV infections. These inclusions are a hallmark of herpes viridae family infections in epithelial cells. Let me know if you'd like a PDF or